Hello to everybody and welcome. My name is Andrei Slavakov. More than a year ago, in my capacity of a Bulgarian member of the European Parliament, I joined the newly established Special Committee on Beating Cancer with the European Parliament. Therefore, I already have sufficient experience, and I'm particularly happy to be able to directly take part in that committee. Let me start by emphasizing that Europe's cancer combating plan is a political commitment. Therefore, we are expected to make political decisions as we are not experts. This is why we have been working with a variety of experts across Europe. I have some data written down. It's not that I cannot remember figures. The main purpose is reversing the trend towards an ongoing increase in oncological morbidity. In 2020, 2.7 million people across the European Union heard the diagnosis cancer. Regrettably, 1.3 million of these are already dead. Unless we take fast and decisive measures, we have been warned that by the year 2035, oncological diseases will have grown by 24. This is indeed horrible. Cancer will be the leading cause of death in the European Union. Europe's plan has four basic and very important elements. Firstly, prevention. Secondly, early detection and early diagnosis. Equal access to contemporary treatment. I think that this is very important, as well as improving the quality of life of cancer survivors. I have my notes, as I have already learned as an MEP to be particularly disciplined and highly responsible, and we have precise time allocators for our contributions. We do have a substantial issue with the less populated areas or areas that are not easily accessible. Early detection and diagnosis is very difficult in these areas. This is why I very much insist that mobile teams be set up. By using the mere echography equipment, it is not always possible. However, it is sometimes possible to detect cancer. I hope that some specific measures will be included in the final document. We are going to address all these issues today. We will be doing this with my colleagues from the European Union, from the European Parliament, as well as some outstanding experts. They will be our speakers in the second part. These are medical experts that have devoted a substantial part of their professional life to beating cancer. You can ask questions by using our Facebook account. So I propose that we officially open this round table, Europe's strategy for beating cancer and the long-term effects for our health. Let me just emphasize that I want to highlight and pay tribute to the work of Bulgarian medical doctors, Professor Dobrin Konstantinov, Professor Janette Grudeva, and Dr. Bushil Robert. They are particularly active medical experts and they enjoy global recognition. They're indeed outstanding specialists. I'm very happy to have been able to invite Associate Professor Natalia Chilingirova and Dr. Hasarjiev to be part of our committee, Becker. They have already attended sessions of ours and they have raised very important issues. We will have contributions from Brussels, Strasbourg, Varna and Sofia. Let us start with the address by Mrs. Joanna Kopcinska. Mrs. Kopcinska is Vice Chair of the Beating Cancer
Chociaż
Committee
wciąż
for the
jesteśmy
ECR.
przed ostatecznym głosowaniem zaproponowanego sprawozdania, uważam, że posłom udało się wykonać znakomitą pracę odnośnie Europejskiego Planu Zwalczania Raka. Jeżeli chodzi o zakres prac w kontekście nowotworów, to bezsprzecznie zgadzam się, że musimy zapewnić równy dostęp do opieki onkologicznej dla wszystkich pacjentów bez względu na ich miejsce pochodzenia. Aby niwelować dysproporcje w dostępie do skutecznego leczenia, uważam, że kluczowym elementem musi stać się polityka nowotworów, przez co podzielam głębokie przekonanie, że wszystkie działania profilaktyczne powinny być częścią naszej wspólnej polityki oraz programów finansowania tak, aby realnie móc wesprzeć pacjentów onkologicznych. Walka z chorobami nowotworowymi to kompleksowy zespół wzajemnie zazębiających się działań. Dlatego niezwykle istotny jest właściwy kierunek europejskiego rynku leków. Należy przygotować odpowiednie rozwiązania innowacyjne, określając trajektorię działań europejskich, która szeroko wsparłaby pacjentów zarówno w samym dostępie do leczenia, jak również zagwarantowałyby innowacyjne terapie. Dlatego z jednej strony musimy poradzić sobie z niedoborami leków, a z drugiej strony przygotować odpowiedni koszyk lekarstw, który byłby powszechnie dostępny dla pacjenta onkologicznego. Wszystkie te działania muszą być jednak gruntownie przemyślane i przede wszystkim należy rozważyć, jak zorganizować system zarządzania nie tyle samym koszykiem lekarstw, ale również systemem zamówień całego procesu, co doskonale rozumie mój kolega poseł Andrzej Slabakow, który czynnie uczestniczył w pracach nad nową strategią farmaceutyczną. Choroby nowotworowe są naszym wspólnym wrogiem i aby skutecznie stawić im czoła na płaszczyźnie europejskiej, potrzebujemy wykazać się zarówno solidarnością, jak i skuteczną, dalekosiężną strategią. Szanowni Państwo, dziękuję każdemu z Was, że dzień w dzień dajecie nadzieję pacjentom z nowotworami i ich rodzinom. Dziękuję za Waszą
Now I have the pleasure to introduce my colleague Pietro Fiocchi from the ECR group of the European Parliament. He did the impossible to attend this meeting. I had prepared for a live conference with all of you, however, we know what the situation is. I very much regret that we don't have interpretation with the Italian languages. We could have communicated in Italian. I will be speaking now Bulgarian, and Pietro will be speaking
thank you very
also
much
English.
to my colleague and friend Andrzej Slabakov for organizing this event, which is extremely important. If you look at the data, and I'm honored to be a shadow rapporteur inside the BECA committee, but if you look at the data, there is a possibility, if Europe works well and united, to decrease by 40% the mortality due to cancer in Europe. And this is an incredible piece of information, in my opinion. And of course, how do we reach this goal? First of all, prevention, and Andrei already mentioned that, early screening and early diagnosis, better behavior by the citizens in terms of overconsumption of alcohol, smoke, and so on, and especially a focus on the quality of life of the patient, because it's been proven that if you take into care the patient from the beginning to the return home, you have a much better success rate in curing cancer. Unluckily, most of the European region, they take the patient, they bring it to the hospital, they do chemotherapy, and then they send him home without taking care of his problem, psychological, therapeutical, everything. So this is important. The other data which is extremely important to know, which Europe needs to work very strong on this, is that there is not a unified approach all across Europe. You have regions in Europe where, for example, they screen breast cancer 90% of the women. Other areas, especially the rural areas, where maybe the screening is only 10%. So when you see this inequality across the European continent, you understand why cancer mortality, depending on the type of cancer, is very different depending where you are and depending what type of approach the local health system is taking with the population. So only on these two concepts, decreasing 40% the mortality of cancer and unified approach all across Europe, we can really save a lot of lives, number one, a lot of money also, because it's been proven that if you do this, you also recuperate a lot of resources all across. And, of course, the quality of life of patients, which is at the end fundamental.
Bene, scusami, ti interrompo per un attimo perché già ho fatto izviniavajte ću govoriti italijanski. Abbiamo rovesciato un po' le cose perché trebaš je da dam dumata na
I should have given the floor to Mrs. Barbara Kerstiens. I hope I'm pronouncing the name correctly. Mrs. Kerstiens is the acting head of Unit 1D Combating Diseases with DG Research and Innovation. Before that, I wanted to pay my respect to my colleague Fiocchi. I do apologize to Dr. Barbara Kerstiens. You have the floor, Dr. Kerstiens.
Good morning, dear members of the Parliament, ladies and gentlemen, dear experts. The topic of today's roundtable is for utmost importance for each of us. Cancer can affect everyone, regardless of age, gender, social status. It also represents enormous burdens to society, as was already mentioned. And if no further action is taken, the number of people newly diagnosed with cancer every year in Europe will increase from the current 3.5 million to more than 4.3 million by 2035. So, as you know, a major milestone in the fight against cancer was reached in February 21 with the adoption of the Europe's Beating Cancer Plan. It's a main priority of President von der Leyen's Commission in the area of health and a key pillar of a strong European health union. And its implementation makes good progress, with several actions launched spanning across policy area from employment, education, social policy and equality, through marketing, agriculture, energy, the environment and climate, to transport, cohesion policy and taxation. But the second milestone was reached, and this is what I want to focus on in my presentation, was reached on the 29th of September with the launch of the EU mission on cancer. And EU missions are about what we can do together to shape the future we want to live in. Missions have ambitious goals and will deliver concrete results by 2030. Missions should reconnect citizens with the European Union by inspiring and empowering them to improve their lives and those others. So Horizon Europe, the European Research Framework Programme, provides initial funding of up to 1.89 billion for the first 3 years. So there are 5 missions, next slide please, yes, in adaptation to climate change, cancer, and you will hear more about that, climate neutral and smart cities, restoring our oceans and waters, and a solid year for Europe. Now let's talk, next slide please, yes, let's talk about the mission on cancer. As I mentioned already, 2.7 million people in the EU are diagnosed, and 1.3 million people die each year of cancer. And it's also worth looking at the cost. In 2018, the costs were estimated at 199 billion. Now, with the missions, what we want to do with the cancer mission is seize the opportunity to improve cancer control, working hand in hand with the Beating Cancer Plan. But importantly, with the missions, is that we put the citizens and the patients at the center of research and innovation. Also, with the mission, we want to give research and innovation a central role in all new policies. So what is the goal, the ambitious goal for this mission? It is to improve the lives of more than 3 million people by 2030, working on prevention, cure, and for those affected by cancer, including their families, to live longer and better, and this is done jointly with the Beating Cancer Plan. Next slide, please. Here you will see a rather busy slide, but to show also that with the mission, we want to create synergies across the intervention areas, the objectives. What we want to do with the mission is get a better understanding how cancer develops and spreads. Importantly, we know that 40% of the cancers are preventable, so we want an action on prevention. Also research actions to find new prevention methods or implement the known effective prevention method more effectively. You all mentioned already that we need to improve our diagnosis and treatment, have treatments that have less side effects, and what may have been neglected a little bit is quality of life. Quality of life not only for those people affected by cancer, the cancer patients themselves, but also the survivors. And then, very importantly, as a cross-cutting issue, we want to improve equity, address the inequalities. In Europe, not every patient that diagnosed with cancer has the same access to quality care, and this is what we want to improve. So the funding for the mission will come from Horizon Europe, obviously, but we want to create synergies with other resources, the cohesion policy, the funds, the technical support instrument, and there, importantly, for those instruments that are managed in co-management, in shared management, it's important that the discussions on cancer take place at the national and regional level. And that is where you all can play a role. Put cancer firmly on the national and regional agenda. It is already on the agenda in the European Parliament. And let's have a discussion how we all together can tackle cancer more effectively. Next slide, please. Now, as I mentioned, the Beating Cancer Plan and the mission work in synergy, and that is why we have developed, together with the colleagues from DG Santé, a unique governance structure. We have an intensive dialogue with the member states through a subgroup that has been created that gathers representatives from ministries of health and ministries of research. We also have created what we call a stakeholder contact group. This is a platform where anyone can register who is interested in addressing cancer, and I warmly invite you to join that platform. In that way, we will, in the course of the years, have webinars. We had a webinar last week, but also we will have specific focus discussion on, for example, what needs to be approved on prevention or what we can do on quality of life. Then, within the Commission services also, we have created what is called an implementation group, and that group gathers all the Commission services that have a stake in cancer to ensure that all the actions that are taken are in synergy with one another and that we speak in one voice. It is about Europe tackling cancer. Next slide, please. We have, again, you will see, created another unique governance structure. We have a mission manager, which is Mrs. Joanna Drake, who is the Deputy Director-General in DG Research and Innovation, working hand in hand with John Ryan, who is the Director at DG Santé. And their tasks are to provide operational leadership and oversee the implementation and ensure interactions with the Cancer Plan and the Cancer Mission. And of course, they will regularly come to address the Parliament. Now, with the launch on the 29th of September of the Cancer Mission, next slide please, we will intensify our outreach activities. We also will intensify our dialogue with the Member States, as I mentioned, but also with the European Parliament and the other stakeholders. Importantly, for those of you experts here in the round table, the Horizon Work Programme for Missions is being updated to include research actions. And we are also updating the Work Programme 22 to include research actions. And I would invite you to look at the implementation plan for the missions that was published, which guides you, gives you an idea in the course of the next 3 years, the areas where we will focus our attention for research, but not only that, to research, the policy dialogue, and possibly support to legislative actions. Also, you know that the goal for the mission on cancer was established by a Cancer Mission Board. It's a group of experts, patient representatives, who deliberated for about 18 months to identify not only the goal for the mission, but those actions that needed to take place to achieve that goal. And they decided to cover the whole comprehensive area from understanding, preventing, treating, quality of life, and addressing the inequalities. Now, with the launch of the mission, the tasks of that board are over, and we will launch a call for expression of interest for new mission board members. And should you be interested, I would invite you to make your application. And I would like you to give you some information sources where you see not only the communication on missions, which covers the 5 missions, but also the implementation plan I was referring to. And then the Horizon Europe Work Programme that, as I mentioned, will be updated to include research actions. We will be sharing the slides with you so you can access these links. And I would like to thank you all.
Thank you, Mrs. Kerstiens. I know that you're in a hurry. However, we have a very interesting question from Facebook. Teddy Dimitrova has asked this question. Mrs. Dimitrova would like to know the following. Is it possible to have vaccine against cancer? This is an issue related to innovations. Is there any chance for a vaccine for cancer?
Yes, this is an important priority. You know that through the HPV vaccine, we can prevent cervical cancer. And we believe that other cancers notably can be prevented as well through vaccines. And there's research ongoing in 2 sides. One is what is called the therapeutics vaccines, and the others are the preventive vaccines, where scientists tell us that it's likely that other infectious agents might be at the source, at the origin of cancer. So definitely research to address, to develop new vaccines is firmly on the table for the mission on cancer. Thank you.
Thank you very much. You were very comprehensive in your presentation. Indeed, I think that what you have presented is particularly informative and useful for everybody who are related in a way or another to this disease. My colleague Dolores Montserrat is our next speaker on the agenda. However, Mrs. Montserrat will be speaking later as we have some technical issues. This is why I'm going to address my colleague Fiocchi. Mr. Fiocchi, as our friend Mrs. Kopcinska spoke about equal access, what is the situation in Italy? I know what the situation in Bulgaria is. What about equal access to medical treatment in Italy?
Not very good. Not very good, meaning that there are some regions in Italy where they're extremely active in screening, early diagnosis, and they have some center of excellence for curing some type of cancers, and other regions where zero, very little screening. The cancer are cured with fairly old type of therapies and cures, and there's not the significant attention to the best way, to the most effective way to cure this type of cancers. Consider also that we start having a little more mobility inside Italy from a point of view of health issues, but there are still a lot of bureaucratic barriers to, let's say, for a Sicilian to go to cure himself in Milano, forget about going to another nation, because in theory there is the free circulation of patients in Europe, but we know very well that reality is not like that. And of course, which is a common problem also with Bulgaria, the people in the rural area are at disadvantage with respect to the people in the cities. So this is all across Europe, I think.
I have observed what you have just said. We seem to be sharing common problems. Many Bulgarians think that this is a unique Bulgarian issue. However, I can assure you that people are confronted with this barrier elsewhere across Europe. I do hope that this new strategy will contribute to a transformation, to a new development. We cannot accept the current situation, namely people having disadvantages or being privileged in certain regions. Yet another question to you. Do you have a plan for beating cancer in Italy, or your situation is similar to Bulgaria's? We still don't know.
Yes, we do have a beating cancer plan as in Italy. Unluckily, it was started some 20 years ago. It was never really applied fully all across Italy, and at the moment it's not even being upgraded with a new indication coming from Europe and from the incredible work that all the technical committee inside the BECA committee has done. So let's hope that from Europe there will be a sufficient push for all the member states, not only Italy, but because there are member states that do not even have a cancer beating plan. So to start with this plan and to apply it everywhere in detail and with a lot of push.
Thank you. I've been doing my best to convince the Bulgarian nationals that these are not issues specific only to Bulgaria. We Bulgarians seem to think that we're always in the worst situation, which is not always the case. There is always room for improvement. We have to make efforts and take care of all our friends, relatives, family members, everybody who suffer from these diseases. What we need is a high-quality strategy. On the 9th of December, we are going to vote this strategy. All of the parliament groups within the EP have agreed on more or less the same ideas. I reiterate that this is a political commitment. Therefore, we cannot allow for any political discrepancies. Mrs. Montserrat is not online yet. Or Mrs. Montserrat is online? No, Mrs. Montserrat is not online. Then we could change the order. I don't know whom I could move on to. If Dr. Maria Tufekcieva is with us, maybe we could give her the floor. All right, so Mrs. Tufekcieva.
She's from the Ministry of Education, head of health prevention with health control directorate. Good morning, can you hear us? Good morning. Mr. Slabakov, ladies and gentlemen, members of the European Parliament, colleagues. Bulgaria declared that it is committed politically and defined cancer as a priority. The National Health Strategy by 2030 has first priority with measures for early detection of the most frequent oncological diseases. Cancer comes second after the reasons for death, after cardiovascular diseases. Beating cancer is a fundamental significance for the future. We have COVID-19, we have increasing challenges with regard to the control of oncological diseases. The incidence is a burden for health and social systems. Modern approach to the diagnosis of cancer through new technologies and research and innovation for service-oriented, patient-oriented care will lead to success in the fight with this disease. Better understanding of the disease and the factors leading to cancer can facilitate the prevention, treatment and quality of life. Saving life through sustainable prophylaxis of cancer is especially important for the Ministry of Health. By the adoption of the National Program for Primary Prevention of HPV by 2024, we will continue the efforts of our country for having an intensive campaign for the significance and dissemination of the disease and the efficiency of vaccines against HPV. Increasing the awareness of society will lead to high vaccinal coverage of the main target group, which will help achieve a sustainable trend for decreasing the frequency of this oncological disease. The main purposes of the National Program for Prevention of Chronic Diseases by 2025 are focused at improving the health status of the population through decreasing the preliminary death rates and long-term effects on health by reducing the behavioral, psychosocial and environmental factors. The program includes having prevention for the most frequent oncological diseases, sometimes for people with difficult access to health services. In Ordinance 8 for prophylaxis and dispensaries, we have screenings for certain age groups for HPV cancer, for malignant prostatitis diseases, and for prevention of groups with high risk factors within priority health care with the national strategy of the Republic of Bulgaria for equality and inclusion of the Roma. With the horizon by 2030, we are implementing services for prevention of oncological diseases through consultative checkups with mobile offices. Bulgaria is implementing the Framework Convention for Control of Tobacco of the WHO and the recommendation of the Council for an Environment Without Tobacco Smoke. The strategy for reducing radon emissions by 2027 and the National Action Plan with it have increased the scope of activity in view of the new requirements of the directives of the European Union for determining the main safety norms and protection against the threats of ionizing emission. The Ministry of Health supports the highest standards for treatment and guidelines for better treatment through integrated multidisciplinary teams. We need equal access to treatment in the country and in the different EU member states. It's important to also provide access to prevention, diagnostics and treatment and care for the people of the socially and economically vulnerable families living in remote areas. Putting the child cancer in the center for improving the care for children with cancer will allow young patients to enjoy an optimal quality of life. The measures for providing better living conditions to patients who have survived cancer and people who take care of patients will improve the professional reintegration and not allow discrimination. The European Cancer Beating Plan encompasses all aspects for effective control of the disease and opens wide opportunities for cooperation between the countries, among the countries from the EU for a better health for every individual. The Ministry of Health commits to conduct a resultative policy in prevention, early diagnostics and care of cancer patients at all ages, under all circumstances, with a network on the global and national levels. Thank you for your attention.
Thank you to Dr. Kopcinska. I have a few questions. In particular, in relation to the following, I know that there is a large group of experts with the Ministry of Health. I don't know what the development is, however. Professor Konstantinov is one of the members of this group, to the best of my knowledge. Could you update us on this working group? The working group consists of leading medical experts in the various oncological areas. At present, the proposals made by them are being summarized. After they have been summarized, they will be analyzed. The next step is moving on to developing the anti-cancer plan for Bulgaria. Thank you. Thank you. Stefan Konstantinov. A question, a classical one, is to me, what is my opinion of Europe without tobacco, without cigarettes? Why do you focus that much on this? There are a number of solutions. I'm not trying to convince anybody that whether they should smoke or not. My advice as a smoker is that you should never take up smoking. This is the more important aspect. So my strong advice is that you never start smoking. Europe without cigarettes is something great indeed. However, this is a kind of addiction. We should bear this in mind. Therefore, we need a kind of an alternative. We know about electronic cigarettes. Maybe this is one of the ways out of this situation, one of the ways to uproot, maybe it's a strong word, to uproot tobacco addiction. I hope I have given a comprehensive answer to this question. I can see that Mrs. Montserrat is with us. All of us, we speak Italian, however, we don't have interpretation with the Italian language. It's my fault.
Ti salutiamo con Pietro. Mi senti?
Do you hear me?
Yes.
Andrei? Yes? Tu mi senti? Bene?
Salve, a te la parola.
Ok, grazie mille. Per me, no, in English. Okay, I'm going to do it in English. Thank you very much. I'm so happy to be here in Sofia with you, Andrei, and with all our colleagues from BECA committee. I just wanted to know at the beginning, I just wanted to say that in 2020, 2.7 million people were diagnosed with cancer, and another 1.3 million people lost their lives to cancer in the European Union. By 2035, cases are expected by almost 25%, making it the leading cause of death in the European Union. The overall economic impact of cancer in Europe is estimated to over 100 billion a year. So Europe needs to renew its commitment to cancer prevention, treatment, and care, recognizing the growing challenge around cancer and reflecting advance in cancer care. A comprehensive approach is needed from all governments that patient-centered harnesses the potential technologies and that spread eradicate fatalities to cancer prevention, diagnosis, and care, and that delivers better health outcomes for patients. The new European Beating Cancer Plan represents an historic paradigm shift. Since the beginning of this European term in 2019, the Commission and the European Parliament have declared health, and in particular the fight against cancer, an absolute priority. The Beating Cancer Plan represents a historic paradigm in the fight against about all stages of the disease. Part of the new European Union Health Programme and Cancer Mission for Research. Fundamental pillar of the new European Union for Health, we are building for a Europe that is the whole healthcare safer, more resilient against any health emergency. So we have not just the BT Cancer Plan, we have in the same tools, we have another tools like the Union Health Program, that it is time in our, in the European Union that we have a autonomous program of health. It has 10 times more budget before, and the object is for health to fight against the cancer. And in the same time, we have another important tool in Europe, Horizon program. This Horizon program is a risk program, and inside of this Horizon program, we have 5 missions. And now it is the first time that we put one mission, that it is the European Beating Cancer Plan. So this means that Europe, it's a highlight, and it's putting in the focus the fight against cancer, because we don't have just the Beating Cancer plan that now we're going to approve in December or January, but we have this European Union for Health program and the mission cancer inside of the Horizon program. Then, context of the new plan. The plan follows a health in all policies approach and will be linked to other European Union priorities, such as the mission cancer, as I mentioned. The new pharmaceutical strategy that we already approved it last plenary in this week. Then the million genomes and the European health data space. It also incorporates this Beating Cancer Plan lessons learned from the coronavirus pandemic and its impact on cancer patients and their treatment, to develop contingency plans to respond to similar events in the future. So the plan is a structure along 4 main axes: prevention, early detection and diagnosis, treatment, improvement in the quality of life of patients, and so on. But always the research are chronic themes in this for access. In the European Parliament, we have the Special Committee on Cancer and are working on a report which will represent Parliament's contribution to the final drafting of the plan and which will also be instrumental in guiding its implementation. And European Cancer Plan Implementation Group will be set up, which will review the first results in 2024. And the most relevant and transformative initiatives of this plan. First of all, a modern approach to cancer, new technologies, research and innovation for patient-centered cancer prevention and care. Second, a strong and sustainable national health systems that invest more and better in cancer prevention. Third, improving early detection of cancer, very important this point. Four, ensure access to quality cancer care for everyone in all around Europe. Fifth, improve the quality of life of cancer patients, survivors, and caregivers. Sixth, reducing cancer inequality in all the European Union. And seventh, for us, very important too, putting child cancer in the spotlight, so the pediatric cancer. So the most significant actions in prevention, we are developing a roadmap for personalized prevention and a partnership on medicine personalized approach to determining priorities for medical research and education and to support research projects related to the prevention, diagnosis and treatment of disease. Second prevention that we are proposing in this European Beating Cancer Plan is launching of the genomic for public health. It's a project in conjunction with the over 1 million in the genome that to ensure access to large amounts of genomic data for research purpose, prevention, and personalized medicine. And then here in the prevention objective, we want to include all local governments, civil society, and patients associations in all phases of the decision-making process for prevention programs. In the second point, in early detection and diagnosis, we are supporting for collaborative projects on the diagnosis and treatment of cancer through the use of high-performance computer and artificial intelligence, inclusion of lung and prostate cancer in the screening programs, possibility of setting up a European cancer screening fund to reduce the risk of cancer inequalities in access to the screening, then development of comprehensive family-oriented screening policies to rapidly detect cancer with hereditary characteristics, and then establishment of national screening centers to share practices, seek replicable solutions, and promote cross-country collaboration. Then in the treatment, what we propose in the treatment, first, establishment of national comprehensive cancer centers in all member states and of a European Union network by 2025. Second, incorporation of new reference centers to those that already exist on cancer. Then we need to digital map of centers of excellence in oncology, in training and treatment in the European Union project. Then support for oncology staff through the interspecialty training program. We want, that our professionals they are really good prepared. Then establishment of an European Union platform of access to cancer research to the using of existing molecules with harmonized European Union dimension, and then implementation of integrated oncology treatment strategies that take into account the mental health of patients and their families. This is a very important point because during all this year, we in this committee, we hear and we deal with the patients, and they are asking us to, all these treatments for, for the psychology of the patients and the families. Then in this, now I'm going to link this last point to link to another very important point for the patients, that is to improve the quality of life of patients and survivors and their families. So they are asking, and this is the reason that we put this kind of initiatives in this European Beating Cancer Plan as comprehensive and multidisciplinary pain management and palliative care service that promote a supportive care, psychology service, and ensure the presence of professional healthcare providers or caregivers prior to treatment, during treatment, and post-treatment. And then increase cooperation between health systems and social systems with the development of socioeconomic support policies, especially for the most vulnerable. Because we have to think, and now I'm going to give a data of Spain, that when the cancer arrives, so comes in to a family, that family every month spend 5 to 700 more euros per month. So the reason that we have health support, economic support to the families too. So we propose two measures to support reintegration into the world of work for survivors in a school and in the higher education for children and youth. And of course, we include the right to be forgotten in European legislation in order not to discriminate against survivors in the access to financial services. You know that perhaps survivors of now they don't let get, for example, a mortgage because they be passionate. We want to be forgotten. We have to help to integrate again to their jobs and life. And then include of nutrition as a key, and then I think so that now something, the connectivity thing, so now. Then the inclusion of nutrition key element in all aspects of the fight against the disease, including research and integration into the Charter of Cancer Patient Rights. So, the conclusions, it is that the health socioeconomic crisis generated by the pandemic has put all sectors, and in particular sector, under tremendous pressure, representing at the same time an unprecedented opportunity to rethink the organization and management of national health, to improve, to help our national systems to improve it. So European action can make a difference, more collaboration between European health systems, especially in terms of best practices, research excellence with years, production and use of medicines and healthcare equipment capable of deal with any emergency, common training system for professionals that will to make our health systems the best in the world, filling in the gaps that we still. So the plan with cancer is a limited opportunity towards the new European Health Union that we want and that we are working for, that puts the patient in the center of all health policies, with the most innovative treatments accessible to all the European citizens, taking care of the social and economic impact of the disease on all the patients and their families. Because we have to think that now, still in Europe, there is a big gap, big difference between 9 days to 1,000 days to get a treatment of oncology. So we have to reduce this big gap, and everybody has to have the opportunity to access and to have the better treatment. As we did with the, so the big example, it is this year that we vaccines. This is a story of successful of Europe, so we are sure that we are going to be again a story of successful with the fight against the cancer. Thank you very much, Andre, and thank you very much to all my colleagues from the Parliament that today we are joining with you our point of view of cancer.
Onorevole Monserrat,
I have a question to you, and I believe that my colleague Fiocchi also has a question for
Ciao
you.
Dolores, in Italy, thanks to COVID, we had a delayed screening by 3 million less screening in 2020 with respect to 2019, and a delay in surgical or chemotherapy by 50 to 90% depending on the type of cancer. So this was the negative part, but the positive part in a lot of regions in Italy, they're trying to push the taking into care of the patient before and after the hospital stay, and they found out that they can reduce the stay in the hospital and have much better results. Do you see the same approach by the regional authorities, health authorities in Spain or in Bulgaria also? Ho sentito.
Well, that the COVID gives us lessons. So the important thing now it is that was in December or in January, I'm going to approve this European Beating Cancer Plan that is going to help all the 20 state members to harmonize with the Union institutions, Commission. We are going to harmonize all the protocols and all the prompt, rapidly diagnosis, treatments, prevention, and to all the survivors and all the patients. So for me, the most important thing is that now we put all these lessons into of this European Beating Cancer Plan, and this European plan is for Europe that almost all the measures of the state members. Why? Because all the European citizens and we need the same access of the same time as we shift with the vaccines, because we did a joint procure vaccines and everybody in the same got these vaccines in 27 state members. Same time we've been vaccinating. So this is the way we have to act. EFPIA Beating Cancer Plan, because it's a challenge for Europe, because there are a lot of still we have a lot of diagnosis of cancer every year. So this is the reason that we have to work all together, because the pandemic shows us that if we are working alone, it's more difficult to give solutions for all the citizens. And when we're working together, of course, maintaining the competent country, of course, but the European Union can help us to harmonize, to reduce the discrimination, to reduce the gaps of all patients in all around Europe. So I think that this Beating Cancer Plan gives us a lot of solutions with the lessons learned by COVID.
Now is the time for me to pose my question. The audience may not know, but Montserrat is a previous Minister of Health of Spain. This is why I would like to ask her, what advice would you give to our Ministry of Health? Because we keep hearing voices that it works too slowly, that it doesn't work with a focus. So what piece of advice could you give to our Ministry of Health?
Well, the importance to invest in the primary care, because in the primary care, it is the first health care that our citizens found, and the primary care is very important for the prevention, because that it is preventable 40%. So this means that from the primary care we can help to all the citizens to prevent cancer. To have a healthy life, not smoke. So I think that we have to focus on the primary care because they are really good professionals and they are helping so much in and I that we are going to certain funds, and of course these funds are for to bring our health system. So now we opportunity for our government, all the 27 governments, to invest, enforce our national health systems, and of course to invest with primary care because the primary care they suffer so much. They had a lot of as the hospital, of course, but they are the first door. The citizens they own the health, the first professionals that they are taking. So for prevention, home diagnosis are on the primary care, and now we have a big of their next generation funds best to reinforce our national health systems. Of course, but at the same time, we cannot forget never the primary care. They are very important. They are strategic for the prevention and the rapidly diagnosis.
Thank you, Montserrat. There is a question from Facebook, from Ognian Atanasov. He is interested in the direct link between labor conditions and cancer. What is the link between the labor conditions and cancer? This should be a question towards the Ministry of Labor, I don't know, but this is a question now to you. Can you say something about this?
Yes, as a member of this cancer committee, cancer thinking, cancer plan committee, and all hearing patients, and of course that they want the best prevention, the best diagnosis, the best treatment. Time, all of them they are asking us support, labor, tax support too, taxes, and social policies too. Why? Because I was explaining before that, for example, in Spain, when one family suffers the cancer, we know that that family is going to spend between 500 to 700 euros per month more. So this is the reason that we have to help with another countries as tax, for example, labor measures to job, of course, or perhaps if they cannot get again because the cancer incivility, incapacity, we have to help them to have a pension on incapacity, short time. So for that PMB plan, we take into account all these measures: labor, social, economic, and tax policy.
Thank you, Madam Montserrat. We have written the report. She was the main rapporteur about the pharmaceutical strategies, so she's an old acquaintance of mine. She's a chair of the petition committee that I'm also a member of. Let me pose a question to Fiocchi. I'm not sure how well the audience is interested in this, but specialists are very interested in this issue. As a shadow rapporteur for the ECR group, what difficulties did you have to get along with everybody else?
No, luckily, I have to say that there was a lot of collaboration all across the nations and the political groups, with some exception here and there. But most of the shadow rapporteur and the main rapporteur, Trillet Lenoir, were very open to compromise, to discuss, to take on the table, and really trying to find the best, most effective way to beat cancer in Europe. So overall, I'm extremely happy. And not every time we find such a collaboration and coordination in many other issues, but on cancer, I think we are going really in the right direction. So I'm very happy about it.
Thank you. I don't know, maybe we are ahead of schedule. We were supposed to finish in half an hour, but we ran out of participants to join us. But what I'd like to say is that unfortunately, this trend of increasing cancer is not only in Bulgaria. I have statistical data. In 95, there were 200 cases per 100,000. In 2018, there are 250. We hear that efforts are being made, but these efforts should be coordinated of the EU as a whole, because this is a huge issue. The second part will continue at 2:30 Bulgarian time with experts to whom you can pose very specific questions. I can guarantee you that they are very competent. I believe they have devoted their entire life to beating cancer. For them, this is a mission. They are not just doctors. So, meet you again at 2:30. There are professors, there are representatives of the Ministry of Health, there are representatives of patients' organizations, even a pathologist, as incredible as this may sound, because pathology is not just a profession that doesn't have anything to do with this issue. Quite the opposite. It has a place when we speak about beating cancer, because in reality, many of the pieces of research are being looked at by pathologists in the end. See you again at 2:30. I hope this first part has been useful. afternoon. Welcome back to the studio Joker Media in Sofia. We're here with Pietro Fiocchi, a colleague MEP. In the morning, we were talking about the long-term effect by the Europe's Beating Cancer Plan and what the implications will be on our health. In the morning, we didn't have many questions on Facebook, so I urge you to pose your questions now. Now it will be even more interesting because we are to hear the presentations of the experts. It's normal that we and the colleague Fiocchi are going to take political decisions, but it's also interesting to hear what the experts have to say. I have invited prominent figures, professionals devoted to what they're doing. Towards the end, you will be able to pose questions to Ivana Catania. I hope I'm pronouncing the name correctly. She's the Deputy President of the Oncological Platform of the European Federation of the Pharmaceutical Industry. There was a question related to the possible vaccines against cancers. There are some existing such. Let's hope there will be more. You will be able to pose your questions to any of the participants. They will have about 7-minute long presentations each. The first speaker that we're going to start with is the head of the Pediatric Clinical Hematology and Oncology Department in Tsarica Joanna Hospital in Sofia. Professor Konstantinov, you have the floor.
Thank you. Thank you to the whole team. Thank you to you, Mr. Slabakov. Thank you for organizing this event, and thank you for letting us be with so many experts and share a number of particularly important issues. I'm going to start my presentation with the following clarification. I will be focusing on a relatively small part of the issues that we address. I'm going to focus more on the medical treatment, the arrangements for medical treatment, and the access to health and medical treatment for oncological patients. The first slide will be reminding us of some information that is not particularly encouraging and happy. In 2014, data from several European countries was published. The results regarding pediatric oncological diseases. These are relatively old results, namely the first years of the 21st century. Nevertheless, this is a worrisome trend, namely Bulgaria doesn't rank very well based on the results. The next slide is just to recall that we have witnessed some success stories with respect to the treatment of pediatric oncological diseases, and this has been a trend. The next slide will just recall, and I will focus on a specific fact, which was which was a focus for the European Pediatric Society. Some 500,000 oncological survivors living in Europe. So we have a very high responsibility with respect to children at risk of these diseases. We have to ensure a high quality of life for all these survivors, the figure that I have mentioned, the 500,000. I would just like to show you the structure that has been in place in Bulgaria for many years. We have 3 pediatric oncological centers, starting with the specialized pediatric centers in Sofia, Varna and Plovdiv. These are multi-profile university hospitals. In view of Bulgaria's population, we have about 1.3 million children. We have 3 large centers across the country. This is sufficient and it is in line with international standards. As for diagnosis, diagnostics has been rapidly developed and improved. I'm not referring only to basic diagnostics, I'm referring only to innovative methods. It is not always easy to have access to the latest diagnostic methods. The next point. Treatment of oncological disorders. This treatment is usually subject to the so-called standardized consensus protocols. These consensus protocols are applied with respect to almost all oncological diseases. We also apply the optimal supportive therapy. It also ensures effective and efficient treatment. However, if we take a look at some of the details of this way of treatment, I would like to focus on the so-called essential drugs. The next slide shows just a snapshot, but it's a very illustrative snapshot. The range of medication that we use for the purpose of standardized treatment is very outdated. However, it is luckily efficient, maybe due to the fact that it is relatively old. Sometimes we have difficulties with the supply of these drugs. The next slide shows or mentions the so-called off-label drugs. A well-known issue that has not been solved anywhere worldwide, including in Europe. In order for many of the drugs to be registered and applied in the case with children, they have to follow a very complicated procedure. However, we very often have to use the so-called off-label drugs. These are not prohibited drugs. These are drugs that are subject to specific registration. Prescribing these drugs is indeed difficult. In case we have to break out of the standard treatment with respect to a specific patient and have to apply a second or a third line medication, then I would say that we do have difficulties with supplying these drugs. The so-called innovative drugs. These are the latest, the most recent drugs. These are drugs based on an entirely new philosophy, an entirely new approach to treatment. However, we still have difficulties, including financial difficulties, as far as supplying these drugs is concerned. We are, however, fully aware of the possibility to address these issues and find solutions This can be achieved by means of international cooperation. We are part of the international cooperation. We do use other reference laboratories. We use the so-called pediatric oncological network for the purpose of medication, ERN-PED-CAN. We use various groups for diagnosis and for the medical treatment plan. These are the so-called working groups that we have in our scientific communities. If we are to focus on local and EU policies in this area, very soon we will be having indeed very good success, and we congratulate ourselves. Let me also focus on cross-border healthcare. We do have the best hopes, and luckily we have the possibility to refer some of the more difficult patients. We can refer them to very good centers, centers of excellence. Thus, we can achieve the maximum effect in the treatment of these patients. As regards the so-called rare oncological diseases, these diseases require specific concentration in specialized European medical centers. These are centers that have a much better expertise and can ensure a high quality of treatment. Of course, we do have cases where patients opt for treatment abroad. We have to firstly exhaust the opportunities of our national health system and afterwards refer these patients to foreign medical centers. Last but not least, participation in various clinical trials. As regards children's treatment, we have relied a lot on medical trials initiated by pharmaceutical companies. In view of the future development, it is very important for our national centers to be involved in centers conducting clinical trials that have been initiated by the academic community. There are a number of very important issues to be addressed, such as the National Oncological Register. We do wish that the arrangements would be improved and it would operate in a more efficient way. We also very much hope that our national register will be brought in line with other European registers. We are a full-fledged member of the reference network for pediatric oncological diseases. We are also a member of CEOP. It was indeed a huge pleasure for me to read the content of the report that will soon be approved by the EU institutions. I'm happy with section number 6 as it focuses on children's treatment, children who are oncological patients. I'm happy, however, with the whole report. Therefore, I do have the greatest hopes. Let me just focus on the last point in this report. It does show that the best wish of the EU structures, the World Health Organization, as well as the local institutions, the Ministry of Health and others, what is required is joint work and well-coordinated work in the future. Thank you for your attention.
Thank you, Professor Konstantinov. The colleague Fiocchi has a question.
Yes, I had a question because I noticed you mentioned the national... Non sente? Okay. I noticed that you mentioned the National Oncological Register. Part of the discussion we are having next week is on the European database on oncological therapy and patients. What is your opinion on this? Because I'm pushing in this direction because, in my opinion, if you have a much larger database, it gets easier to have a better efficiency in treatment of rare and pediatric cancers. But there are some that are opposing because of privacy concern. What is your opinion?
I fully support the opinion that the role of the network and of exchange of information between national cancer registries is very important. Equalizing the information gathering criteria is an important step. I have a certain experience in this. We can see that to a certain degree things haven't been put in order. What do I mean? We need to have the same criteria when we gather data. We are at the start of a pan-European project, so that national oncoregisters start arranging the information, especially with regard to children with oncological diseases. I hope that when this project finishes, we will have a clear idea and joint goals.
Thank you.
Now I will pose a question. It may sound strange, but don't you think that there is a danger for this plan to be made to look more Bulgarian or to be suited for Italy or Spain, irrespective of the country, because this has happened in Bulgaria with the directive with regard to the copyright. So there is a plan, it is applied strangely in the different member states. It is clear that healthcare is within the sphere of competence of every member state. We are sovereign states, but don't you think that certain things should be observed? I also agree with what you're saying, that there are certain risks that such directives may not be implemented as they really should. But I sincerely hope that this will not be the case now, because this idea is huge. It concerns everyone in Europe. Our colleagues should stand their ground, and their ideas should be met with understanding by the respective institutions. We see issues which can be resolved, which will lead to much better results. So we need to make joint efforts in order to pursue our goals. I fully agree that this should be our joint cause, irrespective of which party you are in. Health should not be politicized. This is my opinion, at least. Thank you. And now I give the floor to Associate Professor Dimitar Kalev. He is head of Medical and Radiation Oncology Direction in the Oncological Hospital in Varna. It is a pleasure to see you. You have the floor. Good afternoon, Mr. Slabakov, colleagues, ladies and gentlemen. Thank you for giving me the opportunity to present my concept on the National Onco Plan. I would like to define it as a function of three modalities: definitions, decisions, and policies. In the next slide, I will show you the first modality, the definitions. Definitions can be formed by the three main documents by the European Commission: the Europe's Beating Cancer Plan, the implementation, on its implementation, European missions, and the implementation roadmap. This slide shows how missions should govern all these processes. It is a complex way to govern it, and the National Mission Hub is of key importance. So the National Mission Hubs is key. I would like to show you now the second modality, the decisions. I think that decisions are something that has to have four parts. National Cancer Network, which should include all professional medical organizations committed to oncology care, the national screening and early diagnostics programs, the national comprehensive cancer centers with access to innovative treatment affordability solutions, and psychosocial cancer care programs. With the exception of national comprehensive centers, I believe that all the other sections should be non-governmental structures, of course, with the participation of the academia and SMEs. The four sections should be united at the holistic principle through digitalization and data liberalization. The issue about the nature of the National Mission Hub is under discussion. Should it be with the direct government control, or should it stem from the National Cancer Network with minimum government participation? In the context of Bulgaria, my opinion is that the second solution is better. The National Mission Hub should be non-governmental, stemming from the National Cancer Network. And now you see the third modality, policies. They stem from the state and should include two sections: governmental administrative setting and political procedures. We should add this National Mission Hub, which I think should be a non-governmental structure. Allow me to stratify now the resources that are available in Bulgaria. I could say that National Cancer Network screening programs, National Comprehensive cancer centers and psychosocial care programs are not available. However, we do have national cancer guidelines based on evidence. We do have continuing medical education programs and co-creation with SMEs in the sphere of digital innovations. Allow me to make 5 conclusions. Firstly, the Bulgarian National Cancer Plan should be a co-creation of the European definitions, national decisions, and government policies. Secondly, Bulgaria urgently needs to have a national cancer network to be created, including all non-governmental professional medical associations that deal with oncology, of course, together with the research in the sphere. Thirdly, the discussion about the Bulgarian Mission Hub, whether it should be governmental or non-governmental, I think it should be non-governmental but stemming from the National Cancer Network. Fourthly, Bulgaria urgently needs up-to-date national decisions related to screening, comprehensive cancer centers, and programs for psychosocial support. Lastly, all available resources in Bulgaria related to the oncological guidelines, the continuing medical education programs, and digital innovations should be organically implemented in the future cancer plan. Thank you for allowing me to present this trinity of the National Cancer Plan.
I also thank you, Associate Professor Kalev. Let me recall once again, I understand that this conference, being a specific one, is not followed by that many listeners and viewers. However, you are welcome to raise issues, ask questions, no restrictions, no censorship at all. I'm going to ask a question. We haven't been able to draw up a Bulgarian plan for combating cancer. It has taken us a long time and we still don't have this plan. We know what the trends are. So many people have lost their life in the fight with cancer. When shall we have this plan? Do you think it is high time we had such a plan in place? I think there are 2 reasons for that. On the one hand, the wrongful model, the model based on which Bulgarian oncological issues are addressed. The usual way we proceed is via government institutions. My personal opinion is that in most cases these government institutions have manifested lack of competence and insufficient activity. On the other hand, the agent of solutions should be non-governmental organizations, in other words, the Bulgarian professional medical organizations. However, they are still rather fragmented in their actions. They haven't yet put in place an effective framework network. In a nutshell, a Bulgarian anti-cancer plan can be put in place only if we have a national network for beating cancer. This network will provide the solutions, and the government institutions will provide the framework for implementation. Thank you, Associate Professor Kalev. Let me remind you once again that you can ask questions if these issues are of concern for you. I think that what our speakers are presenting is indeed very important, and all these issues can be applied. Now I'm going to give the floor to Dr. Elena Micheva. Dr. Elena Micheva is head of the transplantation unit with the hematology department at the Medical University of Varna. You have the floor, Associate Professor Micheva. Yes, I'm here. Hello to everybody. Esteemed Mr. Slabakov, members of Parliament, colleagues, thank you for inviting me to take part in this initiative. I'm going to focus your attention on the clinical hematology in Bulgaria in the context of Europe's program for beating cancer. Hematological oncological diseases are a specific area of diseases. They account for 12% of all kinds of cancer. Lymphoid, myeloid, according to the world classification, with a huge variety with respect to incidence, survival rate, and social relevance. Worldwide, over recent years, there has been an increased morbidity. In spite of the substantial progress in diagnostics and treatment, most of them have a highly unfavorable prognosis and outcome. – 130 types of cancer in 2014, 400,000 cases have been registered. The stability-adjusted life years in 2017, this is an indicator reflecting the number of years of life lost due to bad health, death. The Hodgkin lymphoma and non-Hodgkin lymphoma, 1.47 and 2.3 million disability-adjusted life years. Therefore, we have to mobilize resources in order to address this issue. Knowledge has been growing in the area of oncology. The molecular basis has been discovered. Now we have highly efficient therapies, hence the need for changes in the diagnostics frameworks, as well as new challenges in the treatment of hematological patients. Now, the priority areas for development and investment in clinical hematology. The first issue, diagnostic evaluation, diagnostics of these patients. A very important role with respect to early detection and diagnosis and referral to specialized clinics. First and foremost, the role of GPs. Hence, it is very important to focus on improving their training and qualifications. This can be done by means of professional training, seminars, workshops. Furthermore, changing the financial framework for our health insurance system. This will allow more analysis and improved diagnosis for these patients. Secondly, the need to introduce contemporary diagnostics methods. These are methods that are of particular relevance to the diagnosis and the treatment. It doesn't suffice to ensure equipment as well as ensure the training of the medical staff for using the equipment. For the time being, we do not have a reimbursement program for this analysis. We also need to have reference hubs or centers in Bulgaria. They have to be part of European and international ones in order to maintain a high level of quality and control. Another area, the access of Bulgarian patients to health treatment. This is an issue related not only to the general treatment, but also to the introduction of the latest innovative diagnosis methods. The reimbursement of medication that has already been approved in the European Union, allowing access to this reimbursement, is also a step forward. The oncological community has been struggling with the lack of basic medication needed for treatment. The reason is the registration of the relevant drugs. These are drugs used for the treatment of all hematological diseases as well as for stem cell transplantation. The only way to import these drugs is using an ordinance. It is based on this ordinance that these drugs can be supplied. Bulgarian patients need to have equal access to healthcare across the European Union, as well as access to clinical trials in other EU member states. In case Bulgaria does not have the necessary centers for clinical trials. The professional qualification of the staff is equally important. Therefore, we need a specific policy for continued medical education. I'm sorry, the quality of the sound is very hesitant. We should also be part of various reference networks. This can contribute to improved diagnosis, in particular for rare disorders. Awareness raising amongst patients is another line of activity. This is an integral part of the overall treatment. This can be done by involving patients in a number of programs, as well as establishing more patients' organizations. We still don't have enough such organizations. Improving the overall care for oncological patients should become a priority on our healthcare agenda. We still don't apply multidisciplinary approach, including a psychologist, a microbiologist in the treatment. This is done and it is applied only by highly specialized centers. It has to become a common practice. Personalized treatment and approach, hence highly specialized pathologists, microbiologists, they have to be involved in the overall treatment process in the area of hematology. The new realities in combating hematological malignancies, in particular in the context of COVID-19, require changes in social policies by ensuring access to the various pathways in the treatment, avoiding interruptions in treatment, organizing a system for home care provided by qualified medical teams. This is a practice in many European states. And last but not least, improving follow-up actions in order to facilitate our patients' social adaptation, their integration in the society. Regrettably, Bulgaria ranks amongst the last countries with respect to stem cell transplantation. What has to be done in this respect is firstly the development of the national registry for stem cell donors, organizing campaigns to promote voluntary donation of stem cells. Financial support for transplantation is yet another important aspect. Regrettably, there is underfinancing. Therefore, financial support has to be ensured for the development and modernization of transplant centers. In other words, purchasing new medical equipment, what is also needed is developing new standards for good medical practices in the provision, collection, processing, storage of stem cells. Furthermore, improving the qualification of both the medical and non-medical staff directly involved in the transplantation process. In the context of global digitalization and healthcare digitalization, what is required is establishing registers, I have mentioned it, the electronic health records, developing telemedicine. All of these are very important lines of development in the future of clinical hematology. Combating cancer is our everyday mission. However, this requires the joint efforts of many actors. Therefore, I very much hope that Europe's cancer beating plan will contribute to stepping up the process to ensuring integration and joint efforts. Thank you for your attention. Thank you, Mrs. Micheva. Our colleague Fiocchi has a question. I also have a question. Mr. Fiocchi, you have the floor.
Thank you. I agree with what you say, Professor, but I have a question. You know that there are European funds dedicated to research and development, both in diagnostic and in therapies, on innovative type of technologies. If you could decide where to put all this money, what would be your answer? What type of technology would you focus on for the best results?
Yes, thank you for this question. The new standards in diagnosis and the projections require introducing the new methods of molecular genetics, methods such as NGS. These are methods all used in all areas of oncological hematology. We have to use and apply them, namely the methods of molecular genetics. These are the methods in which we have to invest and we have to focus our efforts on these particular methods.
Thank you.
Thank you, Associate Professor Micheva. I have a question to you. I don't know if it is a question or a comment. I'm left with the impression that our national registers are not linked to the registers of other countries. I find this rather strange. This is a very serious issue. It's indeed a concern. We have been addressing this issue for many years. We have a national cancer register. It hasn't been updated since 2017. Furthermore, hematological diseases have their specifics. We need clearly defined criteria for entering the specific data for each hematological disease. Professor Konstantinov also referred to this. This is indeed a huge concern for our country. We don't have registers for the relevant oncological units, and our registers are not linked to European registers. We do have some projects that help us to some extent in this respect. For example, we recently joined a register for a specific disease. I'm sorry, the sound is not very good. I couldn't hear the disease. Thank you, Associate Professor Micheva. What you have said is not very encouraging. I hope that if these issues are included in the strategy for combating cancer at the national level, then we might expect some solutions. Thank you once again, and hello to the city of Varna.
Now I'm giving the floor to Associate Professor Natalia Chilingirova. She's the head of Medical Oncology Clinic at the Heart and Brain hospital in Pleven. She was the first doctor who participated in the hearings of the European Commission battling cancer. You have the floor.
Казвайте, че няма звук. Борбата с техниката е неравна. Както обикновено техниката наделява. Чуваме ли? Говори нещо, защото иначе няма как да се
Please speak so that we can try to work around the technical issue with the sound. Can you hear me now?
Сега вече да.
Now, yes. Thank you. Excuse me for the little delay. Mr. Slabakov, colleagues, ladies and gentlemen, thank you for the participation, for the invitation to participate in this event. The goal of this online event is to discuss one socially important issue. These are diseases which have been in the heart of our discussion for ages. Oncological disease are the ones which give a bad name to medicine. Why? Because of the huge incidence rate and mortality registered worldwide. For Europe, data show 2.7 million newly registered, given 1.3 million deaths. Mortality in the EU is expected to increase by more than 24% by 2035. In Bulgaria, the trends are following the world trends. The Europe's Beating Cancer Plan is a major pillar of EU's health policy. It is a game changer. As regards the collective suprapolitical activities for fighting this socially important disease. The plan is based on 4 major steps: prevention, early detection, diagnosis and treatment, quality of life of cancer patients, and following up of the patients after they survive cancer. This patient-centered approach is based on research innovation, precise medicine of knowledge given by the latest discoveries in the sphere of oncology. As regards prevention, the perspectives are to prevent known risk factors such as smoking, alcohol consumption, obesity and diet, lack of physical activity, pollution, and many more. Since it is the lung cancer prevention month, I'm going to give you that there is one factor which is related to cancer mortality. Prevention, when we establish smoking, or as Mr. Slabakov said, not starting with this harmful pattern, we should prevent people smoking. Believe me, preventing one risk factor as regards an oncological disease would be beneficial with other socially significant diseases such as cardiovascular diseases. As regards the idea about the screening, this is early detection and it has a significant impact as regards cervical, colorectal and lung cancer screening. Screening is important in numerous European countries and is recommended by oncological societies and pulmonological societies. Specialized oncological centers, comprehensive cancer centers aim at something else. They want to give equal access to patients, but timely also access to oncological care in diagnostic and therapeutical plan, and for the following up of the patient. These centers base their efforts on expanded scientific activity, possibilities for close cooperation with other centers, and lastly, of using the latest research in medicine. Cancer is a genome disease as well, and including genetical diseases in huge platforms like NGS technologies have to do with the better diagnostics and more adequate treatment. The quality of life and long-term follow-up is a starting point, especially now that we have better results. More and more patients overcome this disease and are left with active follow-up. These patients have their needs. They need rehabilitation, psychological support, following up in case of recurrence of the disease, toxicity, most often cardiotoxicity. Such toxicities, like cardiotoxicities, led to a platform for cardio-oncology. Lastly, the opportunity for the patient to access all these latest technology. The goals depend on the challenges. Let's set measurable goals on the basis of different national differences in the different countries. Specifically in Bulgaria, let us try to include the screening in our programs. We need closer collaboration between specialized oncological centers. We need to have more opportunities for clinical trials, academic and research trials. Why not? We need better trained professionals. We need a contemporary register and telemedicine and telepathology and professional education in the clinical practice, because they have a key role in medicine. I dare say that in the future the challenge is to have a collective supra-political unified approach to fighting cancer, because it is a national health priority. A cancer patient is there. He or she needs screening, prevention, access to treatment, access to innovation. The plan for beating cancer in the EU and worldwide and in Bulgaria marks the increasing challenges, but increases the opportunities for overcoming these challenges. In conclusion, I would like to say just a few words that what's most important for every plan, for every strategy, for every project is for it to be completed, and we need to have the concrete results from it. Thank you for your attention. We also thank you, Associate Professor Chilingirova. What I liked the most was that we need to have a super-political approach, and I believe this is the right approach. We in the European Parliament, no matter how strange it sounds, are striving to achieve this. My colleague Fiocchi has a question, and I also have a question.
Thank you, Professor. One of the topics which was very heavy in the discussion inside the BECA committee was the tobacco and the alternative to traditional smoking. And for a while we were divided 50-50 between the one that were against alternatives, so the heated tobacco and the cigarettes, and the one that were in favor. I've seen data regarding the Italian situation with a slightly decrease in overall smokers, but with a big increase in the alternative to smoking, which means that the traditional smoking is going down much faster. what is your position? Do you think this is one of the possibility to decrease the harm of smoking, or you would equiparate the two systems?
Thank you for this question. I remember that this was discussed a lot in the European Commission. There were numerous experts who expressed their different opinion, but the question about the alternative smoking methods is going to become graver and graver for several reasons. Smokers are still many in number. It is very hard for a smoker to cease smoking. This is a trend which has been sustained for years. This is why, for this group of smokers who cannot cease smoking but want to decrease their exposure to harmful substances, we have different alternative methods. In all other cases, however, I can only say one thing: stop smoking. This is the only way to prevent developing, or rather to decrease the risk of developing lung cancer. There are no other options. Every alternative way is yet to be researched in the future for any other consequences for the health. Currently, I believe there are already scientific data with regard to one of the systems which got a modification of the exposure from the FDA, which is a plus as regards to the subpopulation of severe smokers who cannot stop smoking. But I reiterate, every alternative has yet to prove with time whether it is a true alternative, whether it could really decrease or modify the risk for lung cancer. In any case, the best prevention is to stop smoking. I believe that everyone would agree. I remember that when we discussed with the European Commission, most of the experts really agreed for political and financial reasons that ultimately the best fight with smoking is to root it out completely. Thank you. It's always a pleasure when Mr. Fiocchi is posing the questions that I want to pose myself. I will try to reformulate my question then. Do you think that there is something new in this new strategy about fighting crime which has not been applied previously in Bulgaria? I believe that the cancer strategy provides us with a lot of new opportunities to do the things the right way. I concluded saying that it is results that we need to have. We need to have the strategies completed, finalized. We don't need to reinvent the wheel. The strategy is comprehensive. There is nothing new that we as experts, doctors, and probably patients have not heard. However, we want to see the results of research put in place so that we can see an active anti-cancer plan giving fruit the way all other member states would have this achieved. And I believe it is achievable in Bulgaria as well. Thanks a lot. Associate Professor Наталия Чилингирова.
Сега ще ви представя доктор
Now I'm going to introduce Dr. Alexandrina Vlachova. Dr. Vlachova is the chair of the Bulgarian Society of Pathology. I think that people have a rather wrong idea about what a pathologist does. This is a highly responsible profession. It is directly related to countering cancer. A couple of days ago, I received a letter from Dr. Vlachova. Dr. Vlachova explained all the issues in that letter addressed to me, but now Dr. Vlachova is going to present them to you. You have the floor. Mr. Slabakov, thank you very much for inviting me. Pathologists are rarely invited to take part in such events. We have a say. The pathodiagnosis is the one that we cannot do without. It is a must. A patient is diagnosed with an oncological disease as soon as he or she has been diagnosed. Afterwards, we can plan the medical treatment. Where does the pathologist step in the fight against cancer? The pathologist participates in diagnosis at all the stages, the screening and following up the patient. The biggest secret is with the diagnosis process, the type of the disease itself. Speaking about anti-cancer, we know that various tissues, various prognoses can be involved, hence various opportunities for target treatment. As for the pathologist whose work remains behind the screen, it remains hidden and unclear, mystical for most people. This is a very complicated diagnosis process, a comprehensive one. It covers a broad range, starting with microscopic analysis of tissues to using specialized analysis at the level of histology. Histology analysis will allow a rather precise diagnosis. Given the latest rankings of the World Health Organization, we can apply various genetic analysis. The tissue itself hides a wealth of information. It contains the keys to the proper treatment and targeted treatment, and of course the successful outcome. What is the state of pathology in Bulgaria? It remains unnoticed, it is underestimated, it is included in the outpatient procedures and clinical pathways. This doesn't allow applying the whole range of pathology opportunities, applying it in a timely manner in order to provide a precise objective diagnosis. This is very important in view of predictive factors. Predictive factors provide us with information about the specific response of the patient, the response to a specific therapy. This is an integral part of a personalized, tailored approach to treatment. It is only the National Health Insurance Fund that recognizes this as a responsibility with respect to breast cancer. As for the other diseases, it is up to the patient to decide. Of course, it is the patient that has to finance the pathological analysis unless the hospital agrees. It is there are pharmaceutical companies that ensure the funding for some pathological analysis, such as the ones for cervical cancer or colorectal cancer. Hence, a certain inequality. We pathologists want to provide all the information that we can have as a result of our microscopic observations. Thus, our information, our data will be helpful for the patient's treatment. The current systems in the hospitals do not allow specialized pathological responses. We do need to have databases into which we can feed our data and results. It is very important to provide additional information from other analyses that have been conducted. This is very important for the individual patient. I do agree with what has been already said. We need an information network. We have to be aware of what is happening in our country. The anti-cancer plan is something wonderful. However, we need information against which we can compare our performance and achievements. We need to find correct solutions so that there would be appropriate diagnosis and treatment for all patients. Thank you, Dr. Vlachova.
No, fai tu.
There is something that I cannot understand. I've been taking detailed notes, but there is something that I don't understand. You said that we don't have specific clinical pathways in our country. How could we have the plan? We have made numerous proposals to the National Health Fund and the Ministry, proposals for individual procedures to be applied. Codes could be introduced, codes for all the specific steps to be followed in pathology analysis. We have the will. Hopefully, the ministries of health across Europe will have the will. This is a system that has been up and running for quite a few years in other EU member states. The European society has also focused on the need to ensure standardized responses. This will be the first step towards having such a network. If we have the best of wish and will, this could become a reality. As Associate Professor Kalek has said, we can achieve this given an appropriate strategy. My colleague Fiocchi will also promise, similar to myself, that we're going to do our best in this respect. Thank you, Dr. Vlachova. Now it is time to give the floor to NGOs. This is the National Patients Organization, Dr. Stanimir Hasardziev. Dr. Hasardziev will present the patient's perspective. Dr. Hasardziev has also taken part in hearings before Becca. Mr. Fiocchi and myself are familiar with Dr. Hasardziev's opinion. He's going to present it now.
Thank you for inviting me to speak on this very important topic. I hope you can hear me okay. I hope that in the future technology will help us even more, because we rely a lot on it, including as patients, but also doctors also rely on having a much better system in the future. In the next couple of slides, I'm going to try to present the viewpoint from the national patients organizations regarding Europe's Beating Cancer Plan and the situation in Bulgaria. A few words about me. Apart from being a chairperson of the Bulgarian National Patients Organization, I'm also the Secretary-General of the Patient Access Partnership, and the access to health is a priority. The access to healthcare is a serious issue in Europe as a whole, especially in Central and Eastern Europe, especially in countries like Bulgaria, where access to quality healthcare is not very good. Speaking about making healthcare adequate and adequately funded so as to be affordable for patients, adequate in terms of the knowledge that doctors have, not while they're studying to become a doctor, but when they graduate throughout their career. These are very important things for the success of every health system. So patients, organizations, and patients and systems underwent evolution through the years in order to achieve today's point, where the patients' organization is no longer an organization of people who go out to protest, to march on the streets. These are organizations of people with a certain disease which are fighting for the success of their health system. What is the role of the patient, and why is it important for the patient to be included in the healthcare system? How can a patient contribute for a more adequate formation of the healthcare system? Firstly, a patient is an expert in being a patient, and this is a unique perspective which is very hard to find from another participant. Why is this important? Because only the patient knows what it's like to wake up with a given disease, to live in Bulgaria or in Germany, what the drawbacks of the education system are, and what should be done so that the healthcare system is more adequate as regards the patient's needs. Throughout the years, the evolution of our idea about what the role of patients is also developed from the patient to be in the center of the healthcare system, and many people believe that this is the center, and that everybody would point to the patient what he or she should do. This has evolved, and now we think that the patient is no longer a passive participant, but rather he or she is a part of the provision of the solution. He's a part of the design of the services, health services, for this patient through the implementation of these services so that they're accessible, understandable for patients, and efficient in the healthcare system. Is the healthcare system designed so as to meet the patient's needs, requirements and understanding. This is a very important question. Often the healthcare system is not understood by patients. People who think they know how a system should operate, working on behalf of patients, for patients, often don't ask the patients themselves about their opinion. And it's important to ask patients so that the system is understandable on part of the patients. Otherwise, we risk all interventions in healthcare not to be accessible and efficient and understood by patients. And what is worse than providing services which cannot be understood and used by patients. Throughout the years, we reached to a point that from a topic focused on the patient, we need to design such a healthcare system which would be even led by the patient, not only designed with the participation of the patient, but even led by the will and the way a patient understands which services and what a healthcare system should include in order to be accessible and affordable for them. So how to make healthcare systems more accessible and understandable to patients around Europe? I'm going to give you some examples. They're recent examples, literally things which happened during the past few days. This is a hackathon which took place with the participation of numerous innovative companies around Europe. They tried to find different ways and approaches in order to make the system more understandable for people and efficient. I'm going to give you several examples of such diverse approaches through which we can be more adequate, more patient-oriented. One of these examples is the following. This is a kind of innovation which was recognized during the past few days. This is the way patients are found and tested. This is a system for supporting clinical solutions which is facing the patient. It cannot be adapted by doctors without the participation of the patient. This is an innovation which was recognized during this hackathon which took place during the past few days. Why is this something innovative? Because for the first time the doctor and the hospital can change and adequately form diagnoses on the basis of what is happening in the concrete hospital, in accordance with the knowledge, experience and possibilities of doctors for an adequate diagnosis. Here you can see another example, another initiative coming from another country within the EU. This is a system for personalized reimbursement of medicines. What is being offered here? Not healthcare systems taking a decision to reimburse a given medicine, which is based on research, but what is being offered here, and probably it will be of help to states, is to take reimbursement decisions on the basis of individual data for a specific patient. For the first time we started speaking about personalized reimbursement. researchers around Europe are trying to find the best approach and to support member states to take adequate decisions on the basis of individual needs of patients. The ultimate goal should be to find solutions in favor of every patient, but also beneficial for the member states, so that they find as fast as possible solutions which correspond to individual needs. More innovations which were presented in this hackathon. By the way, for those of you who are interested, they can see the various and interesting proposals we received during these few days, which give us grounds to have hope that innovations in Europe will help for better solutions for these patients, and ultimately so that states can meet more adequately the needs of these patients. However, will European countries manage to find these solutions and to implement them in time, so that everybody willing to receive adequate help will be able to receive it, is something we're yet to see. Let's hope that member states will find a way to make healthcare accessible to those who need it the moment they need it, not in 5 years' time, but today and now. Because when you have cancer, it's important to treat it soon. Europe can no longer afford to lose lives, to lose valuable time, and for some people this is precious time. So this is very important for their survival. Whether we will manage is something we are yet to see. I hope that with the help of the European Parliament, with the adequate posing of these issues and with the formation of the right policies, we will have solutions which will allow the patients who need it to have therapy and to be supported in order for people in Europe to have accessible and affordable healthcare. Let's hope that the lessons we have learned from COVID-19 will allow us to have the right political support, so that we know that healthcare, apart from being a national priority, will have turned into a European-wide priority, requiring coordination among member states, so that all European citizens would be adequately served and will be able to receive the medical services they need. We can no longer afford to lose human lives in a situation in which Europe needs young people, needs all lives that can be saved. Thank you for your attention. Let's wish that the Europe Beating Cancer plan will be successful, so that Europe will finally be able to say, yes, we have managed to coordinate our efforts. Finally, allow me to shortly speak about the alternative smoking. I myself am a victim of smoke. I have often fought smoking. The only solution I managed to find after personal battle for years is alternative methods. Thanks to them, for the past 4 years, I can say I'm no longer a smoker. Thanks to alternative methods, I managed to find my salvation. Yes, we expect many results. Clinical trials will yet prove or refute the new methodologies, but I don't have 20 extra years of life to wait for the results. I have taken a decision for myself, and I hope that this will help many more people in Europe like me to overcome this huge problem, which is smoke. Let's hope that people will manage to stop smoking, which is the most important and adequate decision that everybody can take. But in case they cannot, we need to propose alternative ways to overcome this vice.
Thank you, Dr. Hasardziev. My colleague Fiocchi has a question, then I will ask a question.
Yes, thank you, Doctor. I wanted to know what is your position on a topic which was very heavily discussed during our technical meeting in the Baker Committee, which is ERAS, or Enhanced Recovery After Surgery. A protocol which says that you take into care the patient weeks before the surgical procedure or any other invasive type of procedure, with nutrition, psychological support, and so on, and then you follow up at home with the care at home, again, rehabilitation, physical therapy, psychological support, nutrition, and so on. This is a method which is used in the US quite a lot, but not so much in Europe. But it seems that there is data that says that you can reduce the hospital stay and increase the success rate of any type of procedure. And of course, the quality of life of the patient gets better. What is the position of your association on this?
Thank you for this question. Indeed, we are faced with a substantial challenge with the organization and the whole medical community. All kinds of protocols, all kinds of systems whereby healthcare is provided. There are huge differences among member states, huge differences regarding the way in which follow-up healthcare is organized. Hence, a variety of results that we observe across EU member states. Healthcare is in line with various quality standards and indicators. We cannot afford to continue dividing EU citizens into first quality and second quality citizens, and hence offer a variety of services to people with huge differences. We have to do our best in order to narrow the gap of differences and divergences and lower the level of divergence with respect to healthcare services. This is very important for the medical community as well. Many countries do not have such protocols, or if they do have protocols, they have different levels of implementation. We, as a European community, have to find a way and align all these standards so that both medical doctors and patients can adequately compare and can have equal access to the high-tech achievements of medicine. This might sound revolutionary to some people. This might not be in line with the view that each and every individual state can manage on its own. This could be the case, however, there are states that do need support so that we can make sure that patients receive adequate health care across Europe. Hopefully, we will have more standards, more benchmarks across Europe. This will allow a situation where EU citizens, irrespective of where they live, they would receive adequate health care. Thank you, Dr. Hasarjeev. I have a very short question. I don't know if it is a question. I was left with the impression that the focus has never been on the patient in treatment, so we have never had a patient-centered approach. Yes, we have observed this in quite a few countries. The issue is not that the state does not wish to ensure adequate care. The system needs to be better understandable, it has to be more accessible. This requires adequate financing, adequate provision of medical staff. Thank you very much. A question that has propped up in Facebook. Mrs. Elena Mileva has quoted the World Health Organization. Our data seems to be older. 3.7 million Europeans are diagnosed with cancer on an annual basis. 1.9 million have lost their life. This is indeed tragical statistics. We have to reverse it. It needs to be reversed. Even if we apply alternative smoking methods and other alternative methods, of course we have to do our best so that if we cannot ensure the standard, or what I rather mean is that we make medicine and medical issues comprehensible, understandable to the public at large. I fully agree with you. We need awareness-raising campaigns. They don't have to be highly specialized. Maybe today's forum is also a specialized and complicated one. I very much hope, however, that the efforts we have been making so far will end up with good results. Now I'm giving the floor to Mrs. Ivana Cattaneo. I hope I'm pronouncing the name correctly. Mrs. Cattaneo is the vice chair of EFPIA Oncology platform. This is, you have the floor, Mrs. Cattaneo.
È giusto, vero? Cattaneo.
Grazie. A lei la parola.
Thank you. Thank you, MEP Slabakov and MEP Fiocchi, and to all the participants today and all the previous speakers. Good afternoon, buon pomeriggio, exactly. So I am Ivana Cattaneo, working for Novartis, but I'm here today in my capacity of vice chair of the EFPIA Oncology platform. And I have to say it has been a very useful and interesting session. I want to start from the numbers that you just mentioned. We always throw this million of number of deaths. And I always wonder personally if we realize that we are in a way talking about people. So in this sense, cancer really represents a societal issue. We always say it's fast becoming the number one cause of death in Europe, but the true reason why it is a societal issue, in my view, is that it's really taking people in the prime of their life. There is a little bit of a misconception that cancer, it's a disease of the age, whereas cancer is actually a disease of the aging. So in that sense, the younger the people, the higher the toll on society, because these are people in the prime of their life, working, being productive, raising children, forming families, and the impact of society, and that's why I really welcome the political commitment. It's really twofold, and I don't want to sound cynical with my economic mindset, but going away in their productive phase of life, it has really a double effect on society in the sense that these people are taxpayers, and at the same time there is a higher burden on the healthcare system, which means if I look at Europe, that really the dependency ratio, so the number of people working who have to take on their shoulder correctly the younger and those not working, it's really becoming lower, and the more it's lower, the more it creates disparity and political instability. And this not to mention the burden on the individual side, so on the family, on the threat that is also posed on the youth and the generation, the young generation, because everybody knows that when such a tragedy comes to a family, there is an impact also on the rising of children, not just economical, but there are many studies that indicate also in terms of ability of these children to really then cope with education, with study, which means then future job they can have, future career. So it's really a political priority that has to be addressed because of this societal impact. In this sense, as a EFPIA Oncology platform, we really welcome the commitment from the European institution with the cancer plan and the cancer mission, and we really think this can open a new era. Innovation is there. Innovation help a lot and can continue to help in advance the approach in cancer treatment by producing better outcomes for patients, and at the same time addressing inequality. So with new innovation coming, there is more opportunity, more chance really also to eliminate the waste that we have in the healthcare system across Europe, and therefore addressing inequalities and making the system more sustainable. I'm particularly fan of the cancer mission in a way because we need research. As you all know, and we were all very happy to see this in the Becker report, 40% of cancer are preventable, which means that 60% are not. There is a lot that we don't understand in this 60%. Many of these cancers are of genetic origin, and therefore we really need to invest in research. However, if we want to realize the ambition of the mission, which is, I'm going to throw the number as well, 3 million lives saved by 2030, it's November 2021. We have slightly nine years. So we really need to hurry up, have the same sense of urgency that we had during a pandemic. We cannot wait the end of the mission to apply the learning. We really need to incorporate the learning in the delivery of care while we go. And at the same time, we really need to be modern, to really look also at our process, use data digital modeling, different type of trial in order to speed up. But also in the way in which medicine or intervention are approved. I mean, there are so many lessons out of COVID. One of them for us, it was the way our regulator, the European Medicinal Agency, worked with the rolling review. I think they were really first class compared also to other regions in the world. And what was really astonished for us was to see that the approval after the scientific evaluation, the approval from the European Commission for the market authorization came in a matter of few hours, one day. Whereas in a normal process, it may come in 67 days. That's another way to accelerate time to patient access and accelerate the cure for those in need. There is an economic study that was published exactly yesterday, where if we look at these 67 days between our regulator and the approval of the Commission, no science anymore, so the scientific evaluation is finished. It's more for administrative processes, translation of the various material. But if we look at what does it mean in terms of people waiting or impact of life that can be saved, it really means that in these 67 days, there is, I really need to read the number because every time for me it's shocking, 18,600 years of potential life are lost. This is something where we have to look into that. And that's why, again, we really appreciate the political commitment. We really appreciate that the European Beating Cancer Plan, in the way it was conceived, with the pillar that are really looking at the cancer journey as a continuum. We always said, as EFPIA Oncology platform, do the plan with the patient in mind. So we are really happy that that this was done, because at the end, only the patient can say what exactly it means, what is it that somebody is going through in that phase. For all the other stakeholders, we really also hope that as during COVID, there was this mindset shift towards collaboration, sense of urgency, really working together for a common objective. We really hope that this is the same spirit that will accompany the implementation of the plan. Somebody this afternoon said, we know what to do. It's true. In the cancer community, being physician, academic, patient, industry, there is a lot of knowledge. It's just sometimes matter to do this. No more talk and a little bit more action to implement. One last thing, and then I'll give it back. It will really be very nice if everything which is done with the mission and with the plan, it's understandable for citizens. Citizens, they need to see how the implementation of the plan and the mission are progressing in a way which is simple, in a language that also my neighbors can understand, because this will help them also being empowered to adopt the right behavioral attitude when it comes to prevention, or also being able to choose and to say something, to have their own voice when they have to take decision on their own care. But in order to do that, we may need to go out from a circle and really put out something which is really understandable by everybody. Thank you.
Grazie signora Cattaneo. Il signor Fiocchi se ha una domanda.
Благодаря ви, госпожо.
Господин Fiocchi има един кратък въпрос. Аз също имам един въпрос.
Mr. Fiocchi has a short question. I also have a
Thank you, Mrs. Cattaneo. You mentioned the long process to have authorization on pharmaceuticals. What is your view on the fact that we have a European authorization agency on pharmaceuticals, and then we have the national authorization agency on pharmaceuticals, and how the system should be changed so that it's more efficient to bring the medicine to the patient in a faster way?
We should avoid any duplication, essentially, because every duplicate, if I think to the regulatory part, we always go back to the same data from the same clinical trial. So what is it that somebody can find differently? That's hard to believe. And the same applies to the technology assessment. So the more certain part can be accelerated, we get the same data. So the more we can avoid duplication, the more days are gained in terms of time to patient access, and the more people, patient and citizen, will benefit about that. And EMA, I mean, it was established only 25 years ago, but it's a gold standard agency at the end of the day. So why we don't leverage it?
Thank you.
Grazie. И сега един въпрос
And now a question from me, because with Montserrat, who created the report on the pharmaceutical strategy, I was a shadow rapporteur, and we met something very strange in all the discussions. The Greens had the crazy idea that in medicines where state money has been invested, shouldn't be intellectual property rights. What do you think about this?
I think essentially, I think we have all seen in COVID what can be done, and we have seen how much health is wealth and vice versa. Without an healthy population, we don't have an healthy economy, and vice versa. Now, if we look at pharmaceutical not just as those bringing this treatment, but also as an economic sector, as every sector, pharmaceutical need to understand which are the rule of the game. So under which condition we are coming, and here is all the system of patent protection, is all the system that has been in place for a year, which produce a lot of results, because life expectancy in Europe increased. We were saying before some cancer were not even pronounceable in some European culture some year ago. Now they have been nearly close to chronic disease. If we want to keep Europe ahead of innovation, keeping attracting investment, really thanks to the pharmaceutical as an economic sector contributing also to GDP. And to allow this to happen, the rule of the game need to be clear. Company needs to know, especially because they face a long process with clinical trials, so they need to know in which territory at the end they are going to land. Something that for me personally is worried. We talked this afternoon about CAR-T, somebody before me talked about that. Well, it's not Europe the place where the majority of the trial on this new therapy are happening. It's China. So we really need a stable system with proper rule, proper protection for intellectual property if we want to see science advance. And when science advances, innovation comes, citizens are healthy, we contribute all to the economy, and we keep Europe a safe place to be in.
Grazie, molto gentile. Io spero... Извинявам се. Почнах на италиански, ма виновен Pietro.
I believe that intellectual property rights shouldn't be breached in any way, and I don't believe that it matters whether the funding comes from the state or from private companies. The person has invested his or her ideas. The researchers have worked for many years, and I don't believe that we should take advantage just like that of their research efforts. Thank you for your intervention. Now I'd like to turn to all the doctors watching, because this has become a very specialized discussion. If you wish, you may pose your questions. Now, the last person that is going to speak today is Mr. Benishev from the Ministry of Health. I hope that he has managed to watch the greatest part of this roundtable or conference, and I hope that he will be able to say something about the creation of the anti-cancer plan on part of the Ministry of Health. Mr. Benishev, you have the floor. Good afternoon. Good afternoon, Mr. Slabakov. Ladies and gentlemen, colleagues, I watched the presentations of all the speakers with huge interest. We heard a very lively discussion. I share most of the opinions. They were by specialists in oncology. We heard that everybody turned attention to the fact that the mortality from certain socially significant diseases is an important indicator of the capacity of the health system, especially as regards the diseases which are responsible for the greatest number of deaths. Holding certain health policies can have direct impact on results. This is what the European Beating Cancer Fund wants. According to National Statistical Institute data of Bulgaria, during the past decade, one of the major reasons for deaths and disability are cancer. They're responsible for over 15% of premature deaths in 2010, and their share is increasing to 15.9 in 2020. All the ways to introduce prevention and screening increase the efficacy of the fight against cancer. Introducing prevention and screening of mammography in specific risk groups has contributed to increasing the share of women with early diagnosis of breast cancer. Together with advanced methodologies of treatment, this would contribute towards decreasing the mortality from breast cancer. In this regard, I would say that together with the Europe's Beating Cancer Plan, the Ministry of Health has started the initiative of preparing a national beating cancer plan, or a national plan for fighting cancer. It includes 30 distinguished specialists. These are the core. They are specialists in cancer diagnostics, prevention, screening, and treatment. This group started operating a few months ago. It has been working intensively, and I hope that soon we will be able to propose to the population the Bulgarian vision of a plan for fighting cancer in Bulgaria. The main thing is we need investment in treatment, in high-tech activities, in providing medication which is adequate, providing access to treatment of all patients that need it, but also we need increased measures as regards the effectiveness and efficiency of the programs for health promotion and health prevention and disease prevention. But we need to remember that we still need to motivate medical specialists at all levels of the health system in order for this plan to be actively implemented. The active exercising of activity to do with health promotion would reduce the impact of health risks. that you talked about. You mentioned already some of them. Lastly, the focus should be on increasing the frequency, the volume and scope of prevention checks, especially as regards oncological diseases. And as I said, they are among the high percentage of reasons for deaths. Currently, there is a national plan for fighting chronic non-transmittive diseases. Within it, for early finding of oncological diseases, there are free screening for breast cancer and other types of cancer. Unfortunately, despite the more than 17,000 prophylactic checkups and as many tests of people aged 18 plus, we think the efficiency is not enough. So efforts need to be focused on expanding the scope of screening programs and increasing the efficiency of the existing programs. Of course, this couldn't be implemented without commitment on part of sustainable funding for holding these health policies. I believe that the Europe's Beating Cancer plan allowed member states to have sufficient information in order to design instruments and their health policies in order to improve the sustainability and accessibility and efficiency of treatment. The scope of possibility for funding different measures, including health promotion, disease prevention, early detection, screening programs, R&D, will allow each of the member states with their own plan to develop their potential in the separate spheres. So I think Europe's Beating Cancer plan and the national Beating Cancer plans are expected to ensure life in a society which is able to protect patients from oncological diseases which could otherwise be avoided, ensure early detection, and presuppose equitable, accessible and suitable ways to treat cancer. With the goals that we had set in the work group for preparing the Bulgarian Beating Cancer plan, I believe that this plan should guarantee that the cancer patients, the cancer survivors and their families and caregivers should be provided with a high quality of life.
In conclusion, let me say that I very much hope that the Bulgarian cancer beating plan will go through its consultation and discussion procedure, and that will happen in the short run. This will allow the relevant stakeholders to present their perspectives. Thank you, Mr. Benishev. I very much hope that this is not wishful thinking. I very much hope that this will happen in reality. 4 billion euro is the amount for the implementation of the Europe's cancer beating plan. What we do need, of course, are projects that will be bankable, projects that will deserve funding. I very much hope that you will come up with high-quality projects that will receive funding. Mr. Fiocchi, do you have a question?
No.
I think that we can call it a day. I do regret, I'm really sorry, maybe many of the things we have been addressing today are not that understandable to everybody. I wish the best of luck and the best of health for everybody. I wish that everybody would stay in life.
Andiamo a finire. No, yes, I do believe the report on beating cancer that we are working on is a good report. It's a very good start. There are still some points that need a fine-tuning before the final vote, but I think the direction is the right direction. You have to be aware that this is a strategy, so it's not from a juridical point of view, it's not a regulation, it's not a directive, and so on. From this strategy, there will be a lot of activities starting beginning next year to revise all series of directive or regulation, like, we will touch the tobacco directive, we will touch the CLP regulation on labeling, we will touch a lot of things. So we need to go in this direction. Of course, now one wonder, starting from such a good document, such a good strategy, will we be able to raise the percentage of screening in certain areas of Europe, especially the rural areas, where sometimes you see only 10% of the people at risk that get screened against maybe 90% in a city. Will we be able to create a European database, which in my opinion is essential for the rare and pediatric pathologies? When I see some resistance because of privacy or because some member states do not want to have the same standards than others. Maybe yes. Will we be able to spend the money which are already being sent to the member states regarding reforming the health system, especially after what COVID did on non-COVID therapies, all the delays and everything else? I think yes, and so on. At the end, as a closing remark, we are going to talk about money. Money, money, money. I want to quote a famous Soviet political man, I will not quote the name, but who said that the death of a man is a tragedy, the death of 1,000 men is statistics. In a way, it is true, but if you look at statistics and if you think that the strategy can be successful in reducing the number of cancer in Europe by 2030 by 3 million patients, run your calculator. I mean, we would be saving hundreds of billions of euros. And from this point of view, one of the things that I'm pushing for, and I know also Andrei and a lot of other colleagues are pushing for, is Europe give more money for the research, for innovative treatment, and for all this, because the return on investment will be incredible. And I'm not even touching the philosophical aspect of the value of the life and the quality of life of the patient. Thank you to everybody, thank you to all the doctors, to my colleagues, and especially thank you to Andres Rabakov for the great organization.
Thank you very much, Mr. Fiocchi. My colleague Fiocchi has said everything that I intended to say. I don't know why I keep smiling from time to time. My wife called me and warned me I shouldn't be smiling as the topic is a very serious one. Maybe I keep smiling as I do have hope that things will go right. I very much hope that we are in for a better future in the upcoming years and we won't be losing that many human lives. We have to be supra-political, supra-party. We have to join efforts as this disease doesn't care about you belonging to a specific political party. This is why I call upon you, be constructive, be normal in your attitudes. We are doing our best to act in a normal and constructive manner in the European Parliament. On the 9th of December, we are going to put to the vote the report. I myself believe that this plan will be approved with a very high majority in the Commission, and then it will also be approved with a high majority by the European Parliament. Thank you very much. I do hope that you have learned a few things during today's event. Do trust the EU institutions, they're not that bad. Thank you very much.